Thank you very much for the introduction. I'm very happy for the opportunity to present part of the results of our current research project to you, addressing the prognostic value of preoperative plasma L-Lactate concentrations in calves with acute abdominal emergencies. We are all aware of the fact that acute abdominal emergencies in calves are serious conditions in which prognosis gets worse with duration of the disease, and that the assessment of the prognosis on the basis of clinical signs can be challenging. Yet, there is no objective prognostic biomarker established which makes it possible to reliably assess the prognosis of those calves. L-Lactate is known to be associated with disease severity and mortality in critical ill humans and animals, and several diseases have been examined focusing the question of L-Lactate's prognostic value, like, for example, septicemia or colic in horses, as well as neonatal diseases in foals or gastric dilatation volvulus in dogs. Yet there's no information about the prognostic relevance of L-Lactate in calves with acute abdominal emergencies, but for example in calves with bronchial pneumonia, L-Lactate has shown to be a useful prognostic indicator. Therefore, the objectives of the present study were to determine whether L-Lactate is elevated in calves with acute abdominal emergencies and whether it is possible to reliably assess the prognosis based on a single preoperative determination of the plasma L-Lactate concentration, and if the predictive accuracy depends on the underlying diagnosis. For the purpose of the study, a retrospective analysis was conducted, and the medical records of all calves that were hospitalized at the clinic for ruminants between May 2005 and August 2015 were retrospectively analyzed. The inclusion criteria was an age up to 6 months, an admission to the clinic because of an acute abdominal emergency and concurrent surgical intervention, and the existence of the blood analysis. So, the information extracted from the medical records were age, sex, and breed, the main intraoperative diagnosis, which was determined out of the operation report, the outcome until discharge from hospital, and the plasma L-Lactate concentration, which was determined as part of the routinely performed biochemistry panel on admission. So, let's come to the results now. A total number of 587 calves were included to our study. Median age was 4.9 weeks and sex was evenly distributed. Most of the calves were German Simmental, as this is the most common dairy breed in Bavaria, Germany. And as it's the standard protocol in our clinic, anesthesia was performed as a combination of injection and inhalation in most cases, and the surgical approach was through the right flank. The most frequent diagnosis was a generalized peritonitis in 108 calves. This generalized peritonitis appeared as a result of sepsis in most of the cases. The second most frequent diagnosis was a torsio mesenterialis intestini and a right displaced epimasum or epimasal volvulus. And the third most common diagnosis was a volvulus intestini, as you can see on this picture, which was evident in 50 calves. We have then calculated the median plasma L-Lactate concentration for every diagnosis with according first and third quartiles, after we have grouped the diagnosis under the effective part of the digestive apparatus. And as you can see at the epimasum, right displaced epimasum results in lower increase of L-Lactate than an epimasal volvulus. At the small intestine, calves with a volvulus had the highest median L-Lactate concentration with 5.4 millimoles per liter. And it's notable that at the large intestine, an intussusception does not go together with an increase in L-Lactate above the physiological limit. In those diagnoses which affect multiple parts of the digestive apparatus, the torsio mesenterialis intestini is protruding. It is not only the overall second most frequent diagnosis, but the diagnosis with the highest median L-Lactate concentration of 8.9 millimoles per liter. In those diagnoses which were grouped under the heading of abdominal cavity, It's notable that the generalized peritonitis and the local peritonitis have a similar increase in L-lactate. On this flowchart, you see the outcome of the calves until discharge. You can see that few calves had died prior to surgery, but most of the calves were euthanized during surgery, and additional 126 calves died or were euthanized after surgery was finished, which leads to an overall survival rate of 31% in the study population. Some studies have shown that age can be a useful prognostic indicator in calves with acute abdominal emergencies, and we have therefore grouped our population into 10 deciles based on their age. These are presented on the horizontal axis. The black dashed line is placed at the overall survival rate of 31%. And you can see that calves in the first and second decile, so the very young calves with an age from 0 days to 1.3 weeks, have much lower survival rates than the rest of the population. But let's focus on L-lactate now. L-lactate was elevated in 75% of the calves, and the median plasma L-lactate concentration was significantly different between the survivors with 3.1 millimoles per liter to the non-survivors with 4.9 millimoles per liter. But there's a considerable overlap of values, and this overlap is also presented in this box plot, where the L-lactate concentration of the surviving calf is presented on the left, and of the non-surviving calves it's presented on the right. We have then formed 10 deciles again, but now based on the median L-lactate concentration. The 10 deciles are again presented on the horizontal axis. The black dashed line, as you already know, is the 31% survival rate, and the blue dashed line marks the cutoff for the physiologic L-lactate concentration of 2.2 millimoles per liter. And we can see that the calves in the 9th and 10th decile, so those with very high L-lactate concentrations above 9 millimoles per liter, have a significantly lower survival rate than calves in the 2nd decile, so those calves with an L-lactate concentration within the reference range. On this slide, you see the L-lactate concentration on the horizontal axis and the predicted probability of non-survival on the vertical axis. And the results of the binary logistic regression analysis indicate that the odds for non-survival increase by a factor of 1.14 with every 1 millimole per liter increase in L-lactate. We have also performed a receiver operating characteristics analysis to test the diagnostic power of L-lactate, and the area under the curve was 0.65. And through calculation of the Uden index, which optimizes sensitivity and specificity, we have calculated a cutoff of 4.56 millimoles per liter, which has a sensitivity of 54% and a specificity of 69% for predicting non-survival. When we now go down from the level of the whole study population to the level of diagnosis, we found significant differences in the L-lactate concentration between survivors and non-survivors only for these 3 diagnoses. So the area under the curve for calves with a paralytic ileus was 0.97, and in calves with a torsio mesenterialis intestini or a small intestinal volvulus, area under the curve is 0.8 or 0.79 respectively. We have not found significant differences in the L-lactate concentration for calves with the right displaced apomasum or apomasal volvulus, as you can see on this slide, and also an incarceration or intersusception at the small intestine do not lead to significant differences. And it's also notable that the overall most frequent diagnosis with a generalized peritonitis has not shown a significant difference between survivors and non-surviving animals. So when we now come back to our questions from the beginning, whether L-lactate is elevated in calves with acute abdominal emergencies, we can conclude, yes, it is. Most of the calves which suffer from an acute abdominal emergency have increased plasma L-lactate concentration. But to answer the second question, whether it is possible to reliably predict the outcome based on the single preoperative determination of the plasma L-lactate concentration, it needs a little more differentiated answer. The results of the ROC analysis indicate that it is not possible to reliably predict the outcome of those calves. But nevertheless, survival rate in calves with markedly elevated L-lactate is very poor. And at least if the predictive accuracy depends on the underlying diagnosis, we can say yes. In calves with paralytic ileus or a torsiomesenterialis intestini, as well as a volvulus intestini, we found higher areas under the curve than in the whole study population. Now I'd like to thank for your attention.
Thank you.